Welcome, this is Don with Abundant Life, and I want to do a quick review of the updates in eRSP. So I'm here logged in as our test nurse, John Doe, and we are going to go to my calendar, and I have visits set up for our test patients, so we're going to take a look at the changes. When I enter the visit details tab and the patient attachments tab have remained the same. There are no changes there. But when I click on the post timesheet tab, we notice that it looks a little bit different. Especially here, there's a new tab called Care Notes, which you may or may not see, and I'll get to that. The Nurse Notes tab and the View Time tab. So I'm going to talk briefly about each one of these. The Care Notes tab is a new feature in which we can create our own custom assessments. The first one that we have completed is the controlled medication count. So I'm going to click on that. Basically what we're doing is instead of the controlled medication count being here in the assessment, we've made it its own special tab. And that does two things. Number one, it allows us to track it a little bit better. And number two, it takes it out of the assessment for those of you who do not need it, those patients who do not have controlled medications. So let's go ahead and run through the controlled medication count really quick. All right, so question number one, medications counted at the start of the shift with, I'm going to write other nurse, and I'm going to say, it's going to ask the name, so I counted with Dawn. Okay, question number two, medications counted at the end of the shift, I'm going to count with PCG, so mom's name. Okay. Number three, I would like to report irregularities in the count. This is a way for you to let us know that there's something odd going on with the count. We don't expect to ever use this, but if there is an issue, we would like you to document it here by responding yes. If you respond yes, you have a chance to explain, and it alerts us that something's going on. If not, we're just going to write no. Okay. Each medication has its own section. There's room for up to 5 medications. And for this example, we're going to use 2 medications. So click yes to enter the first medication. And the medication is Valium 2 milligram tabs. Okay. Count at the start of the shift, which is the next question. I know it goes against everything we've ever been taught, but we do not want to put the unit of measure. So for example, if I have 5 tabs, I'm just going to put 5. If you put 5 tabs, it won't save. Only put the number. Okay. The next question, was the supply of this medication refilled during the shift? We're going to say no. And then count at the end of the shift, which is 5. Okay, we're going to enter another medication, yes, and this medication is going to be, we'll just say a liquid Valium, 5 milligrams per milliliter, okay, and Tensol. All right, count at the start of shift, 30, right, for 30 milliliters. Was it refilled? Yes, my mom came and refilled the bottle. So now it's 45 milliliters, and we didn't give it. Okay? So for this example, we had 2 medications. For the other medications, we're just going to indicate no. All right? So there's a couple of cases where we have that we don't count medications even though they're there because they're not accessible. So in these cases, let's say every medication is inaccessible, right? We don't have access to any of it. What we would do is we would write in this question number 1 that medications are not accessible to nurse, and then question number 2, right? Because we're not counting. Okay, all of these would be reset or to no. Okay, we're going to have to certify that we don't have access, right? This is just reaffirming. And then you don't have to enter these medications in this instance if every medication you do not have access to. Okay. If it's a case where you have access to some but not the rest, for each medication that you have access to and you do not have access to, you would write nurse does not have access to the medication, right? And this lets us know that you didn't count it because you don't have access to it. And we're going to change that to 0. Okay? So that's the controlled medication count. And that's the first tab, new tab here, under care notes. You may see more tabs come as time goes on and we develop new tabs. But that's the first one. Okay? The second new tab here is nurse notes. Right? So it's right here. And this is the big difference because you're used to logging in here and seeing all of these little tabs, right? But what eRSP has done is they've taken it and made it into one drop-down menu. So it'll function the same way that it already has for each section, but you would just select it from the drop-down menu. Here I'm on Vitals, right? INO, MAR, addendum, all of it is exactly the same. And it's going to indicate here which section you're on, right? So there's the MAR, nurse notes, etc. Okay, so that's the nurse notes tab. The last tab that we have here is this view time tab, right? This is new. And this is the answer to an issue that we've been having with signature. As you all know, in the full site, you weren't able to obtain the signature until immediately after you clocked out. Now with this view time tab, you are able to get that signature at any point during the shift. Okay, so now that this function is available, we are going to definitely start rejecting for signatures, and then you can obtain them, of course, anytime by clicking here, right? And it works the same way as it always has, right? The parent signs. You write their name, or the nurse who relieves you, same thing. You write their name and click Save. Okay, the Clock Out tab used to have the signatures, right? But now the signatures are obtained in the View Time tab. So the only thing we're going to do in the Clock Out tab is obtain that signature. Okay, so that's it for the changes in the full site. The mobile site, which I'm going to go to now, doesn't have as many changes because some of the stuff has worked the same way all along. So I'm going to go to this week's assignments, and into that, visit for Cole Mannequin, right? The clocking remains the same, right? So the clocking tab, you clock in, you clock out, it's exactly the same. Notes, the Notes tab is going to stay exactly the same because we've always, in the mobile site, been able to obtain the signature at any point during the shift. So all that's going to stay the same. But you are going to see this new tab, Care Notes. Okay, and I'm going to click on that, and here we have our controlled medication count. Now, all of this is, of course, going to be in here for us. It's the same exact thing. Only in the mobile site, you're going to have to fill it out completely before you can submit it. Right? So if you want to fill it out, beforehand, then you're going to want to do that in the full site. But if you're going to fill out the whole thing, then you can do it in the mobile site. See, if I try to submit, it's going to say they're unanswered questions. So it needs to be completely filled out. In both cases, it needs to be completely filled out before the notes are submitted. But in this case, it needs to be completely filled out before you can even save it. So again, that includes putting no on these medications and entering all the fields. Okay, so that's it for the changes in the mobile site. Of course, we are always here for you. We're always here to ask questions. Please send us a message in eRSP. Call us during office hours. Text the on-call phone, and we will definitely do whatever it takes to get your problem solved. Okay. I hope you all have a wonderful day.